And you know what, long term, I think that's, the more that people like yourselves really focus on that and differentiate yourself from all the other people that in theory can do pretty much everything that you're doing within your clinic with toxins and fillers and, fat freezing and all these other things, not obviously with the same sorts of devices. But I think then people will start to understand that different if they're getting those different ancillary messages, especially in the consultation process as well, which I think is really smart, because I think people miss that, don't they?
They do. I mean, I write down 3, maybe 4 health messages. So I write everything that they presented with, diagnosis and treatment plan, and then health messages. And usually this would be something like boost the immune system, lose a bit of weight, and use a science-backed skincare or regime or something like that, or even practice mindfulness. Because we have a lot of people more than ever that are very anxious.
Yes, I'm absolutely sure. Yeah, I mean, and you're right, that's all part of the overall health and wellness, isn't it? Aspect of being, hopefully a healthy, well-rounded human being. And you're right, I think those kind of medical messages are not easy to access on the NHS anymore, even if they were actually ever.
I mean, I look back to more public broadcasting, BBC for want of a better word, when, in the AIDS pandemic, we had John Hurt and the gravestone of RIP.
Yes, I remember it well.
And now, a lot of our patients won't remember that. They're of a different age group, but, and also they're not watching public broadcasting. So I do think there's a role for good social media messaging around care. I mean, I said when I was in Colombia, when all my friends were saying, "Are you safe? What are you doing?" And I was like, "Well, I'm rafting down a gorge at the moment. What's going on in the world?" I said what we need is a calm world leader. I'm not sure that anybody's emerged yet, Dalai Lama or someone like that, the Pope, I don't know, somebody calm. But it's the same in healthcare leadership. I know that we had, the wonderful people that came on the daily bulletins, etc. And also I know that people are cynical about the science being slow or flawed, or even Imperial College getting the modelling wrong, and taking data out of China rather than data out of Italy in order to get us into lockdown earlier, and all of those things that, with the benefit of the hindsight spectroscope or whatever it's called, we could all sit there smugly. But I am a creative thinker, and I am to be giggled at. I know people giggle at me all at work, but I just love something like a public health warden or of a similar vein to be walking around our towns and chatting to the young people, a bit like the old Bobby on the Beat, but that doesn't exist anymore. Or the nurse that used to have her cape on and her leather bag to say, hello there, do you all come from the same family? Oh no, do you have grandparents and parents that might be shielded? It's best that maybe you remember to sit away. Hey guys, I know it's hard to forget, hard to remember, but just social distance a bit and remember about your granny and grandpa maybe catching this virus if we're not careful. It needs something like that. I don't know who's going to do it.
Well, but I think maybe, there are, thousands of nurse-led private aesthetic clinics up and down the country. Maybe if they did take on part of that role from an education point of view in terms of when they're talking to people, and all, just the messages that you're getting out on social media that would differentiate you from other providers anyway of aesthetic treatments and elevate you. Maybe, maybe that is something that people could do. I mean, irrespective of COVID as well, of course, this has been the odd thing really with all of this. When you're looking at, respiratory infections are always there, whether it's cold and you have a nasty cold, it's not very nice. Flu kills anywhere between 17 and 28,000 people every year. Same categories as well, generally older people and people who have pre-existing conditions, lung problems or whatever. So it's been there for a long while, and that's even with a vaccine, of course, as well. So I think reinforcing those messages is not a bad idea, and this could be a catalyst for that.
Yeah, I mean, I'll tell you, we've already sent a member of staff off. She turned up with a sore throat and then gradually felt a bit worse during the next few hours. We sent her home and we got her straight in and got her a swab. And we'll wait now before she can come back to work. And for the swab to be clear, she's a bit annoyed, but what else are we to do? That's what we're to do.
Well, yeah. Absolutely, and it makes absolutely perfect sense, because you wouldn't want not to do that and then run the risk of any.
And I think, the anti-vaxxers are out in Oxford, Ron. This, when I grow old, I shall wear purple. I'm going to add, and shout in Speaker's Corner at the anti-vaxxers, because this is what this old nurse did. So I was out in Oxford at the weekend, and the anti-vaxxers were out in our equivalent of Speaker's Corner. It's called Bond Square. And they're telling us about the removal of their civil liberties by the possibility of having to be vaccinated. Guess who shouted back at them? From the shopping crowd? Me. I heard this person speak and shout, "Are you a scientist?" Stuff and nonsense. It was me. I am an activist, even in my old age. I'm an activist. Yeah.
Well, that's wonderful, and I hope you remain so, Mary. I really do. So look, I really appreciate your time, and I know that, and thank you, because I know you kind of squeezed me in between.